Welcome. Thank you for joining Consumers Doctors. I'm giving daily talks on several healthcare matters and modern trends and what's going on in healthcare. As you all know, healthcare is $3.8 trillion budget every year, and it is being wasted. So I continue to dwell on it because it is almost like 17.8% of the GDP. My goal is to lower the cost of the healthcare. So today's topic, let's talk about. Yesterday we spoke about modern trends, and as a consumer's doctor, let me tell you about certain specialties in the fields of medicine. There are a lot of things can be improved and changed, and overall delivery of the care. So I'll give you six different specialties. There are other specialties that are equally important, but I'm focusing on six today. Number one, general practitioner, so-called, or a family practitioner. We can embrace a lot of things in general practice, folks. With COVID, we can take full advantage of the COVID situation and see what we can do to improve general practice. I think I mentioned in the previous topics, general practice is probably the most important field for family medicine. So what I would like to see is this telehealth, telemedicine has changed the general practice. The reason I say that, the technology is such, you can talk to your doctor with your mobile phone. You can get the advice from a mobile phone, and you can also get the treatment and payment system through your mobile phone. So what will happen is ultimately the general practitioner is like visiting you at home and taking care of you. There are a lot of illnesses, folks, it could be handled on telehealth. Routine, like chronic illnesses like hypertension, diabetes, mental illness. Mental illness is very important, and mental illness can be handled even through AI, automation. So general practitioner can screen all this and can refer to a specialty, and general practitioner does not have to have a clinic. He can probably see the patients online, communicating directly to you with all the technology we have. We have vital signs. We can get all the vital signs recorded. We can get your blood pressure recorded. And when you do an examination with a patient, most of your interaction is during the history part. When you obtain an history, you can probably come to a conclusion more than 50% of the time, folks. I'm not kidding. So most of the time, this history itself is relevant, and the vital signs are relevant, blood pressure is relevant, and there are other things we can gather the information with wearable technologies, which we have it available. So general practice is going to be a tremendous impact and changes coming in the healthcare. I can't reemphasize more than anything else. General practice is like your family doctor coming home. That significant it is. And patients with mental illness, we have an issue with mental illness. As you all know, we can address that, talk to you, and give a supportive thing right at home, staying at home. That's number one. General practitioner, family practitioner, and and even the electronic medical records, folks. Whatever you interact, the way you interact, it is electronic medical record. It is private. You have to be HIPAA compliant. Your interaction with your patient, it's a file. That itself, you don't need a separate paper documentation, folks. You have a file already been made. A data is already recorded and stored aside. That's number one. Number two, which is an important field, is obstetrics and gynecology, especially the obstetrics part. Obstetrics part is relevant because prenatal checkups normally can be done through telehealth. Very rarely they need to be seen in the clinic unless they need. Even nowadays they have this portable ultrasound. They have these devices, amazing. You can check your fetus through a portable machine, ultrasound, putting on your belly. You can see the fetus. You can literally document everything what you see to telehealth. So obstetrics, prenatal checkups, and counseling, and if they need, especially when you talk about the congenital anomalies, they need a little more thorough checkup so they can be pre-screened prior to having a baby. So pre-screens, you can probably do a visit to a diagnostic center. The blood tests, you need to go to a lab. So obstetrics, prenatal evaluation, especially that's going to go through a lot of changes, folks, because when you're about to deliver, obviously you have to be in a center where you can, we used to have deliveries at home. Family practitioners used to have delivered babies at home. So the good old medicine is still there, folks. It is, I've seen midwives delivering babies and mother doing yoga and having a baby delivered in the tub right at home. Those days are coming, folks. The technology is there, and we can compensate midwife. Unless it's a complicated pregnancy, they can evaluate and predict earlier, and it could be seen in the hospital. So OB is going to be going through a revolutionary change, and all the documentation is available, prenatal documentation. And number three in the category of specialties is radiology. Yeah, radiology. Radiology. You go to a place, you don't even have to have a radiologist. For routine imaging studies, you go to a diagnostic hub. They will do a CAT scan, MRI, you name it. Unless you need an intervention from a radiologist, most of this imaging can be done when you go to a diagnostic hub, and it is read by a machine, AI, artificial intelligence. They can do a better job. Humans are prone for errors, but believe me, AI is going to revolutionize radiology and telehealth, telemedicine, teleradiology. Radiologists, if the imaging studies are done, radiologists can stay right at home, look at the imaging studies. Once it's read by AI, if there's anything wrong, he just needs to sign off on the final sign off with a human. Make sure there's a human intervention, but that it's minimal cost, and it should lower the cost for overall delivery. Number 4 is ophthalmology. Why ophthalmology? Because nowadays people with blindness, you're talking about retinal implants. You can regain the blindness. There's so much going on in ophthalmology, and blindness correction, and you have neuromodulation and lot of things. Even a person can read and write, and automation. People with visual problems, Yes, I think the ophthalmology is an upcoming thing. There's going to be changes in ophthalmology. Number five. Number five. Sports medicine. Yes, sports medicine. They're going to go through rapid, revolutionary changes with portable technologies, portable ultrasounds, portable devices, and right in the field. And you can not only make a diagnosis, get the imaging, get the immediate results, and sports medicine. It's going to be even head trauma, you know, head trauma, you made bodily injuries, everything could be a revolutionary thing in sports medicine with up-to-date technology, and that's going to be it's going to be transformed in sports medicine. Last but not the least is number 6 is oncology. We almost have with studies going on, we are going to find a cure for cancer. How about that? We are able to define our body immune system in such a way it can kill these cancer cells. You can be cured from cancer. It's not too far away. We can have treatment for majority of the cancers. In oncological studies, we have proven over and over again. Then immune modulation, immunology, that's going to revolutionize care for cancer. And that's going to bring down the cost, and you don't have to, most of the time, you don't need to be hospitalized. It can be handled in an outpatient setting. And I would like to see come up with a cancer cure. In today's environment of going to Mars in the space technology, oncology is going to ultimately find a cure. I'm pretty sure immunotherapy, whatever modulation is going to change. I'm not talking about these toxic elements of, like a cancer therapeutic agents with all the side effects. I'm talking about the cure for cancer, man. We can find a cure for cancer. It's not too far off. So these are the 6 specialties which have a brighter and a challenging future ahead. And all you physicians out there, they're doing an excellent job, and we need to lower the cost of the care. Ultimate goal is to lower the cost of the care using technology, folks. This billing system needs to be gone, man. This billing system is completely revamped. We need to pay as you go through a personalized healthcare. That's what the beauty is. Personalized healthcare. If I'm seeing a doctor on telehealth, telemedicine, and there's also a beauty. If missed appointments, no shows. Telehealth is such, if you make an appointment, if you don't show up, you're automatically charged. So non-compliancy will go down dramatically. That is one of the problems with no-shows and non-compliant patients. So if there is a non-compliant patient, he doesn't listen to the routine stuff, you are going to be personally responsible for the bill. And physician needs to be compensated. Even if there's a no-show, you're automatically billed to your personal health care accounts. So it's coming, folks. Thanks again for joining. I love you guys. I will love interacting with you. I would love to see your comments. I'll thoroughly enjoy it. This is, as a physician, I get gratification if you make comments and subscribe, share, and hit that bell for notification. Thank you. We'll see you tomorrow, another episode on Consumers Doctors Channel. Thank you very much.